Well, Royal Free is one of the first hospitals in the whole of the country to take in COVID-19 patients back in February. Now, staff here, as well as the rest of the country, have made unbelievable sacrifices. Many of those we've heard on our programme over the last couple of months or 100 days. People staying in ICU, staff there holding the hands of people whose loved ones couldn't be there, care home workers who actually stayed in their work because they didn't want to risk contamination. Now, today's clap is remembering all of those workers who have done those unthinkable jobs. We took a look back at the 72 years of the NHS. This was the National Health Service at the very beginning. Payment for treatment stopped 72 years ago, a founding principle that still stands. This year, more than most, the NHS has faced an unprecedented challenge. From the very first cases of COVID-19 in the UK on the 31st of January, hospital staff have been at the forefront, caring for those who were the most ill. The personal toll has been huge. Hundreds of NHS workers and care staff have died from COVID-19. Their sacrifices for the sake of their patients have led to the nation paying tribute.
Doctors, paramedics and countless other staff have made costly sacrifices to provide treatment for more than 100,000 patients with coronavirus and thousands more who needed other care. And in tribute to them, we have come together as a nation to thank them for their skill, professionalism and dedication.
They're putting themselves in mortal danger and they're doing it cheerfully and they're doing it with everybody's good in mind. I think they are doing marvellous and I think they're so brave.
For 10 weeks on a Thursday at 8 p.m, this is what many did. Clapping to show support. Alongside buildings and homes covered in drawings of rainbows, the British kids' way of saying thank you. But while anniversary celebrations are taking place today, the politics around the NHS doesn't stop, with bosses warning of significant costs to come, reports suggesting they need billions more in funding. Wouldn't it be better to, instead of clapping, supporting the NHS and giving them the money that they deserve, the 10 billion figure that's been talked about a lot today?
We've put an extra £30 billion into the NHS this year, as well as writing off over £10 billion worth of debts of NHS organisations. So absolutely we're putting the money in and working very hard to make sure the NHS has all that it needs in what is undoubtedly the most difficult crisis in its history.
As the NHS turns 72, they've never seen a year like this. Doctors, nurses, cleaners among those literally risking their lives to battle coronavirus. The UK has had nearly 300,000 confirmed cases of COVID-19, and we haven't had a day without any cases at all. The NHS are still at the front line of tackling this pandemic. For them, this isn't over. And with the easing of lockdown restrictions in England comes more fears of a significant rise in cases. What's being called a second wave will be very concerning for those who will have to treat new coronavirus patients.
Well, I'm joined now by Dr. Matthew Morgan, an intensive care consultant from Cardiff, and Francis Fernando, who is former Vice President of the Filipino Nurses Association UK, who has worked in the NHS for over 20 years. And we're going to be talking up until 5 o'clock when people start clapping, and then perhaps a little bit afterwards. But Matthew Morgan, first of all, I mean, the NHS hits this point after this most extraordinary crisis in its history. How do you think coronavirus has changed the way Britain holds the NHS in its esteem?
Well, I'm standing about 50 miles away from the Welsh industrial heartland where Nye Bevan discussed that concept of the NHS. But of course, in the days that he did this, he had just a handful of drugs and a fistful of operations. And now with 6,000 different treatments available, some cancer drugs which can cost as much as £250,000 for a year, things have changed radically. And yet that starting premise of free healthcare at the point of what people need it is more important than ever. And I think people realise that simple free market economics can't support these amazing once-in-a-generation effects, whether it's antibiotic resistance or whether it's pandemics. And that's when institutions are really the key.
But the last few months, we've seen, the clap for carers and these sort of expressions of affection for and thanks to health workers in a way we haven't seen before. And so I wonder whether you think there's a lasting change in the way the country will hold the NHS. Do you think we will stop debating whether we can afford to fund the NHS and whether we should fund it a different way and all of that kind of stuff, and just say, get on with it and make it better?
Well, it's undoubted from those days of Bevan, it's a radically different place. And the truth is, what to do about that funding is not complex. There's only three choices. You either tax more, like many of our European neighbours do, or you ration more, and we already ration to some extent through NICE and the cancer drug funds, or you partner up with others. The difference is we need to do, like Bevan said, this is my truth, tell me yours. We need to be truthful and honest and talk about those issues. And that's the truth. And in terms of those issues, at the centre of the NHS are not expensive machines or drugs. There are people, there are staff. And those are the people, those are the things that investment is needed in.
Well, Francis Fernando, let me bring you in here as a nurse who's worked in the NHS for an awful long time. I mean, does thanks like this, when you see politicians, as you will in a couple of minutes, standing out there applauding your work, does it mean anything unless, they also say, and here's the money to go with it?
Hi, good afternoon, Christian. Well, to be honest, clapping is all right as long as the nurses and the frontline workers are adequately protected. Obviously, we still got a lot of issues working in the front line with regards to inadequate PPE protection. Risk assessments are still not being done in other NHS trusts. So, and you mentioned about the pay. I mean, the pay compared to other professions here in the UK is very minimal. Especially for the frontline nurses. So really, it's okay for us to be appreciated by clapping every Thursday, but they need to be doing more than that.
And you're one of the sort of the 1 in 5 NHS workers from an ethnic minority background. Do you think the NHS has been able to rise to that particular challenge recently?
Well, the statistics speaks for themselves, Christian. We have the Filipino nurses and other healthcare workers, unfortunately, suffered through this pandemic. A lot of my colleagues have died, 57 of them have died, and a lot of Black and Asian minority ethnic staff have died. We have the largest death rate of any nationality, and collectively we make up around 60% of all the staff deaths in the NHS, the Black and Asian minority ethnic group. So I know that there are different factors with regards to our susceptibility to sustaining coronavirus or to having coronavirus, but obviously there are also...
Well, people are starting to clap now because it's 5 o'clock. So let's just pause our conversation for a moment and hear and watch.
Yeah, okay.
Well, Matthew Morgan, let me come back to you after that. I mean, we've seen the Chief Medical Officer say he expects coronavirus to be with us until the spring, at least. And the Independence Age have said that means 27,000 more deaths, possibly, by that time. I mean, having gone through what you've gone through in the last few months, how do you feel about it?
Well, I guess is the NHS prepared for that next step along that road? And in many ways, yes, we have new treatments that we know can work. Britain ran one of the biggest global COVID studies from the University of Oxford, the recovery study, where we have a drug now which can reduce deaths in the illest by up to a third. We know how to use the equipment better. We've been training. We've got new protocols. So yes, in some ways we're more prepared. But as I said before, the thing at the centre of the NHS are those cleaners, those porters, the nursing staff, the doctors, the people. And those people are tired. So it's wonderful to see the Prime Minister clapping tonight. That's fantastic. But for the first time in my life, I'm hoping for a slow, steady hand clap, not a fast one that just comes and goes with sound bites. What we need is consistent, ongoing support. And I think that's now more important than ever.
And just briefly, Francis Fernando, do you have the resilience and strength to carry on at this pace for months more?
Well, unfortunately, possibly not for many months more longer. The staff there, the Black and Asian minority ethnic staff and Filipinos are really at the end of our tetras, and we are really fed up, and we need some support, and we need the government and the NHS to really give us those support.
Well, thank you both very much indeed for joining us tonight. Thank you.